So let's talk about exercise and pinched nerves. And if you have a pinched nerve and you're looking for some way to exercise or relieve that discomfort, we're going to be talking about those things today. So we're going to talk about the intent of exercise, what that exercise looks like, and what are you actually doing to the nerve. Let's explore all of those things and have some fun today. Here we go. So when I treat my clients and they have a pinched nerve, it's either because they've had an MRI and it's confirmed like either they have a disc bulge or herniation or stenosis, some sort of condition that's limiting the space around the nerve, causing symptoms into the glute or down the leg. That's the most common presentation of a nerve type pain. It happens in the lumbosacral plexus, which means it could be L4, L5, L5S1, typically the sciatic nerve. That's the most common area, but this information holds true for neck pain and arm pain as well. But when you have nerve pain, it's most likely sharp, shooting, stabbing, burning in nature, and can be accompanied with weakness or sensation changes down the leg and more aggressive symptoms such as bowel and bladder changes or reflex changes. And the only reason why I'm mentioning all that stuff is because when you team up with a movement professional or a physical therapist, someone that's going to help you get better, they're going to monitor those symptoms along the way. And so if you feel comfortable, doing it on your own, that is what it is. But if you have a movement professional on your side, they're going to help monitor those symptoms over time. Now, if you've had the MRI that's confirmed disc bulging or disc herniations, just know, and the evidence is pretty clear too, in that over time, most people improve. Conservative treatment such as rest or doing nothing or ice or some sort of manual manipulative therapy that a chiropractor or a physical therapist can do, all can help monitor and relieve symptoms along the way. So if you have a pinched nerve, just know it's pretty common. It's also common to have pain down the leg, into the glute, into the calf, into the foot. All of that stuff is kind of fair game in that a lot of people get better on their own. But when you're wanting to involve exercise and use exercise to help improve symptoms, that's when things can get a little tricky. And when I work with my clients, one of the biggest things we talk about is what that exercise is doing. And so I will tell you that that exercise is not actually taking mechanical pressure off the nerve from the disc bulge or the herniation or stenosis. You can't have change in that area that quick. And I'll give you an example that a lot of times my clients with nerve pain, simple movements such as standing or bending backwards or bending forwards can cause a sharp shooting discomfort into the glute or lower back or down the leg. And if I were to do an MRI at that instance where you have the pain and the instance right before you have the pain, the changes in your spine don't happen that quickly. So don't judge the improvement of your pinched nerve off of the imaging. And so don't use an X-ray or an MRI to judge and see if your nerve is pinched or not, because there are plenty of people that have a pinched nerve or a lack of space around the nerve without symptoms. And there's plenty of people that have a mild pinching or a mild lack of space around the nerve with symptoms. And so just don't rely on the imaging to tell you if your nerve is still pinched or not. And pinched nerve is a little bit of a misnomer in that the nerve isn't actually pinched. And what we're finding is that when your body has some sort of insult or injury in that area and it generates some inflammation, that nerve gets irritable, it gets very, very sensitive, and that's what causes your discomfort. It's not the actual pinching, it's the actual inflammation that sits around the nerve. And that's why sometimes movement, a lot of times movement helps, because movement helps move that fluid in and out. The classic example is, do you feel better in your knees or hips or back after you've been moving and up for a little bit in the morning? Well, absolutely, because you move some of that inflammatory soup around. So movement and exercise is essential, but it's how you do it that matters, and we'll cover that in just a second. But when we're talking about a pinched nerve, you can't rely on the imaging. It's not really pinched, it's about how you feel, and that's absolutely important. So if you have sharp shooting discomfort, burning down the leg, numbness and tingling, all of that stuff is within normal. Don't get freaked out. It can get better, but exercise can be a great way to relieve those symptoms. So if you're wanting to use exercise to improve your symptoms, this is what I tell my clients when they have nerve pain. So when I'm treating patients who have a pinched nerve, they usually have symptoms and they have a lack of function. And so the function can be difficulty walking or bending over, and the symptoms can be the pain, the glute pain, the hamstring pain, the pain down the leg. And so we're wanting to improve both of those. And when I treat those clients, most commonly I see difficulties with walking and difficulties managing the discomfort. And so the discomfort being the burning. So the things that we talk about is gentle movement and exercise. Of course, if you go to your doctor, they're going to probably prescribe some sort of strong anti-inflammatory and maybe a muscle relaxer and maybe some imaging, even though you most likely don't need it, and then some other things. But when you really want to look for that relief, you want to use your body's natural healing ability plus movement to give you the results that you're looking for. And that is proven in the evidence to work. It's not the easiest route, it's not a pain-free route, but it is a route that absolutely works. And so I'm going to go over things with you that I have seen help clients. So there's usually a couple different schools of thought or different categories you can sit in with nerve pain. And so that's going to dictate. And this video is going to be more for people who have that moderate to severe discomfort. But there's old and cold, and then there's hot. And so hot is you can barely do anything without having symptoms into your glute, hamstring, or foot or calf. And cold, which means you're doing okay, but you're having some residual stuff along the way. And this video is going to be great for both of those categories, but I'm going to assume that you're in not very good shape because you're looking up this information and you're wanting to improve the way that you're feeling. So I'm going to go over that. So when I'm working with my clients and I'm talking with them, we're going to improve walking ability, we're going to learn to manage symptoms, and we're going to do it in a way that is going to match your body and how it feels in this moment. So that is a very much of an art, but we're going to go over the nuances around that right now. So in your spine and around your nerves, motion is lotion. So we use movement to help move some of that inflammatory soup that's sitting around your nerve in and out of there so you can feel better. Most of the time, people don't like being in one position for a long period of time. And I'm sure you feel that. And then if you've been sitting and you've got a little bit of a rounded back, you've been sitting there for a while and you may feel comfortable in that moment or semi-comfortable, but when you go to get up, things can be a doozy, and that's absolutely okay. That's relatively normal, but we're going to use motion and the movement of your body to help improve the inflammatory soup or the sensitivity of the nerve. And so I'm going to show you how to do that. We're going to focus on improving walking and discomfort, but we're going to do it in a way that's safe. So what I'm going to have you do is that you're going to lie down and you're going to get comfortable. And I know this may be challenging at times, but try to lay on your bed. Softer surfaces can be comfortable, but just hang with me. So you're going to lay on your bed, your knees are going to be bent, and you're going to get in a comfortable position. So remember when I was telling you about how you do it matters? And so what we do is called a pelvic tilt, but how we do it matters. And so what we want to do is focus, and remember the lumbosacral plexus, that tends to be the place that these pinched nerves and this nerve pain originates. So we're going to work there. So we're going to do the tilt back, and push our butt into the bed, and then curl our butt in the air and flatten our lower back. So doing that full motion helps you move through the ranges of motion of your spine that you need for bending over and walking. And if you have discomfort, we're going to flirt with it, not push past it. So you're going to tilt back until you feel it, and then poke your butt into the table. Tilt back until you feel it. And when I say feel it, it could be this, it could be this, it could be down the leg into the calf. It could be either of it. Tilt back until you feel it. Now, when I'm working with my client and I'm watching them from the side and doing this, what I see them do is try to do too much too fast. Listen to your body. It is much better for you to do 50 reps into a comfortable range instead of 10 reps at a very uncomfortable range. So don't make that mistake. Listen to your body. Nerve pain can linger. It can stick around if you do the wrong thing. So don't do that. So when I give my clients these, we're talking multiple times a day, doing 50 reps or so, 30, 40, 50 reps. That's all fine. This is not a strengthening exercise. We're using motion to calm down the inflammatory soup around that nerve. And so we're not actually fixing the pinched nerve, we're working on improving the environment in which the nerve lives. And that's key. And when we're looking at the evidence to treat nerve pain, that's what it's talking about. We're not going to focus on what they found on the MRI or X-ray. We're going to focus on how you feel. So we're doing these tilts, and what you'll notice is that you'll loosen up as you go. But that motion is lotion. And why this exercise works is because you're not weight bearing. You don't have the pressure of gravity pushing down and compressing the nerve. Nerves are made to be compressed and pulled, and we're doing both of those things when we're doing this, so we're regaining the nerve's natural ability to function. This is key, guys. Like, this is what's going to make a difference in your recoveries when you understand these concepts, and that you may feel it for a hot second, but then when you come out of it, it goes away, and that repeated motion improves the way that you feel. And I've probably done 30 reps or so here, and I'm already starting to feel looser in my lower back. I feel pretty good here. And when I work with my clients, we're gonna stay in this position when we work on the rest. And so if you've got a hot and heavy nerve and you've got a significant amount of discomfort, this tends to be the most comfortable position for us. Feel free to use a pillow underneath your head if you need to as well. And we're still doing these tilts. Now, I feel like I've gotten the most out of this because I've gotten my available range and I'm not feeling any pulling anymore. And so you could use your body as a guide. Now we're gonna move into the nerve glide here. So again, this is a little nuancy. I'm gonna pretend I have the discomfort on my right leg, but this applies to the left as well. I'm gonna straighten my left leg, I'm gonna bend my right leg, and I'm gonna support it here. Now, I am going to have this in a comfortable position. It doesn't have to be at a 90-degree angle. You could pull up more, and I'm going to kick up and pull my toes back and go back down. Up, toes back, go back down. Remember how I told you that nerves are meant to be compressed and pulled, and so right now we're pulling the nerve, and now we're decompressing the nerve. Pulling the nerve. The key here is pulling those toes back. So kick, pull, toes back. And when I do that kick and pull my toes back, I feel into my calf area. That is a normal thing to feel. So when we're wanting to improve our ability to walk and our ability to bend over, it's these types of things that are gonna help. And this is a type of nerve glide. So I'll do 20 or 30 reps here. And then what I'm gonna do is I'm gonna stick my leg, I'm gonna let it just extend a little bit more, and I'm gonna pull it back. I'm gonna vary this angle. It's harder the closer your knee is to your chest. It's easier the knee further away. Now I'm feeling a burning into my quad. It's just my muscle working. So I'm gonna pull my toes back, I'll hold for 2 seconds, 1, 2, and back down. Now for this one, you will feel that burning, and some clients of mine feel it when they just go right here, and they feel it already down their leg, calf, buttock. I know it sounds weird, but it's absolutely possible. And if you're having just some lingering discomfort into your glute or hamstring, you can keep going. All right, we're gonna do the pull and pull back. So it's kick the leg out, it's pull the toes back. Kick the leg out, pull the toes back. Now again, 20 or 30 reps, and then when you go to rest, just relax, bend those knees up, and just take a good check in on your body and see how you feel here. Now, these are both improving symptoms and relieving symptoms at the same time. And so what I mean there is that we're using the pelvic tilt and the nerve glides to improve how you feel in that moment and how you feel when you go to get up and start walking again. I never ever tell a patient to do these if I ever think they're gonna feel worse afterwards. And so play with the range of motion, play with the nerve glide, ask some questions if you have any, right? I'll get to them. It's really nuancy, but we're using the pelvic tilt and we're using the nerve glide to improve things such as walking, such as bending over, and just overall having the feeling of nerve pain in our glute, hamstring, and calf, etc. So using exercise to fix pinched nerves is crucial. Using that movement is crucial, but don't give up on it if you feel like it's not working for you. You like team up with a physical therapist that can help you along the way. There's a lot of nuances to consider, but those are 2 great ways to improve those symptoms that are relatively low risk and high reward. And so using the pelvic tilt and using the nerve glides can help improve those symptoms. Listen to your body along the way. Ask questions if you have any. Do these 2 to 3 times a day. I'll put that in the description, but it's important to consider all of this as you're moving forward and trying to use exercise to improve your nerve symptoms. I hope you guys find this information useful. You know, guys, engage in the content if you have any more questions, but just stay healthy, keep moving, and take care of yourself.